Okay, so in this video we'll take a look at the brachial artery, which is the artery, the main artery of the arm region, and after giving its radial and ulnar branches at the elbow joint, it also supplies the forearm region through its definitely the radial and ulnar arteries, right? So let's take a look at its beginning, course, and termination, and its various relations. So it's actually a branch, or I should say the continuation of the axillary artery beyond the level of lower border of teres major muscle. So when we talked about the axillary artery in our previous videos, we said that the axillary artery was arising as the continuation of the subclavian artery beyond the level of lateral border of first rib, right? And then it becomes the brachial artery at the level of lower border of teres major muscle, right? So and then just by arising from the, or I should say continuing from the axillary artery, it passes laterally and downwards until it reaches the elbow joint, where it terminates as the two branches, that is the radial and the ulnar arteries, which will be supplying the forearm region, right? So here we have the brachial artery, and it is just a continuation of the axillary artery. And let's take a look at its various relations and how it will be passing. So as you can see, it is just a continuation of the axillary artery, right? And it's just moving downwards and medially until it reaches the downwards medially and then laterally, and then it's just divides into its terminal two branches, that is the radial and the ulnar arteries, right? So let's take a look at its various relations. So as we just saw, that it will be running downwards and laterally till the side of the front of the elbow, and throughout its course it is superficial and it is accompanied by so whenever we say that an artery is accompanied by venae comitatus, it means that a single artery is accompanied by two veins on each of its side, right? So the same goes for the brachial artery. It is, I can say, accompanied by two venae comitatus throughout its course. And anteriorly in the middle of arm, this artery is being crossed by the median nerve from its lateral to medial side. So in the front, in the upper part of the arm, this artery is related to the median nerve laterally, while in the lower part of the arm, this brachial artery is related to the median nerve medially, right? So in this way should be a reminder of its relations. Just in the middle of arm, the nerve crosses the artery, right? And then in the lower part of the arm, that is at the level of cubital fossa, this artery is covered by the aponeurosis of the biceps brachii muscle. And it augurs anterior relations, that there will be median nerve and there will be bicipital aponeurosis. What about its posterior relations? In the posteriorly, this artery will be related to the triceps brachii muscle, the muscle of the posterior compartment of arm, the radial nerve, and the profunda brachii artery. We said that profunda brachii artery is also always accompanied by the radial nerve, and these both are the contents of the posterior compartment of arm, so it will be in the posterior relations to the brachial artery as well. Then medially in the upper part it is related to the ulnar nerve and the basilic vein. Okay, so these are two superficial veins of the arm region, that is the basilic vein and the cephalic vein. Cephalic vein is always on the lateral aspect, while basilic vein is on the medial aspect. So medially we'll be finding the ulnar nerve as well as the basilic vein on the medial relations of the brachial artery. Then laterally we'll be having the muscles, coracobrachialis muscle, the biceps muscle, and the median nerve in its upper part. You can see the biceps and the brachialis muscle on its lateral aspect, and the median nerve then goes on the medial aspect on the lower part of the arm. Then at the level of elbow, at the level of cubital fossa, the relations are such that medial most we have the median nerve, then we have the brachial artery, then the bicipital aponeurosis, or the tendon, kind of a tendon of the biceps, and then most laterally we have the radial nerve. So in this way these are the relations of the brachial artery at various levels, right? Then let's take a look at the various branches of the brachial artery, and there are several muscular branches which are unnamed. Definitely it will be passing through several muscles, so it will be giving a few twigs to those muscles as well, but the major branches are such that this is a profunda brachii artery. We often keep talking about the profunda brachii artery accompanying the radial nerve. So this is actually a branch of the brachial artery, the profunda brachii artery, which arises from it just below the level of the teres major muscle, and it goes in the posterior compartment to supply the posterior compartment, because it is a major vessel of the posterior compartment of the arm, right? So just after its origin, it just winds around and goes on the posterior side of the arm, right? The second branch is the superior ulnar collateral artery, which is just given off from the brachial artery, and it will be taking part in the anastomosis around the elbow joint, right? And then the second one is the inferior ulnar collateral artery, once again taking part in the anastomosis around the elbow joint. And then there are some terminal branches of the artery, that is the radial artery and the ulnar artery. And then there's also a neutron artery which is given off to the humerus bone as well, so we should be knowing about that as well. So total there are 6 branches, that is the profunda brachii artery, superior ulnar collateral, inferior ulnar collateral, the neutron artery, and the 2 terminal arteries, that is the radial artery and the ulnar artery. In this way way we have just taken a look at the different branches of the brachial artery along with its several relations and its beginning and its termination. Okay, so now let's take a look at the anastomosis around the elbow joint, which is a very important topic. And this is you can say a network kind of communication or a union between the branches of the brachial artery and the branches of the ulnar and radial artery. Ulnar and radial artery are also the branches of the brachial artery. So these two arteries are giving some upward branches, or the ascending branches will then be communicating with the descending branches of the brachial artery, right? So let's take a look at it. So the anastomosis around the elbow joint is divided into 4 parts. That is the anastomosis in front of the lateral epicondyle, anastomosis behind the lateral epicondyle, anastomosis in front of the medial epicondyle of humerus, and anastomosis on the posterior aspect of the, or the posterior side of the medial epicondyle of humerus, right? So in this way we'll be taking a look at the different branches of several arteries which are taking part in the anastomosis in each of these parts. In front of the lateral part of lateral epicondyle of humerus, there is a branch called as the radial collateral or the anterior descending branch of the profunda brachial artery. We saw that profunda brachial is also a branch of the brachial artery. So there is an anterior descending branch or the radial collateral branch coming from the profunda brachial artery. Okay, and from downwards जो कि एक recurrent branch move कर रही होती है, which is a branch of the radial artery called as the radial recurrent. Whichever artery is moving against the course of its main artery, that is called as a recurrent branch. So the main radial artery is going downwards while the radial recurrent branch is going upwards to anastomose with the radial collateral or the anterior descending branch of the profunda brachial artery. So ये तो होगी बात about the anastomosis in front of the lateral epicondyle. Now anastomosis on behind the lateral epicondyle is such that there is first we saw the anterior descending branch of the profunda brachial artery. Now we'll be looking at the posterior descending branch of the profunda brachial artery, also called as the middle collateral. So from so this is going to be the this was okay, so it's not visible in this diagram, but there is a branch called as the posterior descending or the middle collateral branch from the radial artery, which will be anastomosing with the posterior interosseous artery. Now you must be thinking, what is a posterior interosseous artery? It is a branch of the common interosseous artery, which in return is a branch of the ulnar artery. Okay, so the ulnar artery will be giving a common interosseous artery, जिसमें से anterior or posterior interosseous artery निकलती है, right? So that posterior interosseous artery will be moving upward and will be joining the posterior descending or the middle collateral branch of the profunda brachial artery to form the anastomosis behind the lateral epicondyle, right? And then let's take a look at the anastomosis in front of the medial epicondyle. So these are okay, so there are 2 branches called as the inferior ulnar collateral and the superior ulnar collateral, जो हम already देख चुके हैं. In front of the you can say in front है अगर medial epicondyle का, तो वहाँ पे in front से याद कर सकते हैं inferior ulnar collateral, right? So inferior ulnar collateral branch of the brachial artery will be anastomosing with the anterior ulnar recurrent branch of the ulnar artery. Since it is on the anterior aspect of medial epicondyle, so it will be anterior ulnar collateral. So inferior ulnar collateral branch will be anastomosing with the anterior ulnar recurrent branch of the ulnar artery, right? And behind the medial epicondyle will be such that superior ulnar collateral branch of brachial artery will be anastomosing with the posterior ulnar recurrent branch of the ulnar artery, right? So in this way, this is an anastomosis. It must be read several times to really learn it by heart. So this was the anastomosis between the various branches of the brachial artery as well as the radial and ulnar artery. हमें anastomosis याद करने से basically different arteries को भी मेमोराइज करने में हेल्प मिलती है कि किस तरह से डिफरेंट ब्रांचेस डिफरेंट इसकी फर्दर ब्रांचेस के साथ you can say communications बना रही हैं. So with this note we're done with the brachial artery, its various branches, and anastomosis of its various branches through its branches with the other arteries, right? So thank you so much. Take care of yourself. Allah Hafiz.